Good evening, and thank you so much for joining us tonight for Denver 7 News at 5. I'm Jacqueline Allen. We want to start this evening with the influx of migrants in the city of Denver and the recent impact. According to the City of Denver's Migrant Sheltering and Support Dashboard, more than 32,000 migrants have been served by the city since last December. Denver spent more than $30 million on response efforts. Last month, Mayor Mike Johnston took his concerns about the migrant crisis to the White House, along with several other mayors. He says if Denver does not receive federal support, the city could spend as much as $100 million next year. And with this unprecedented number of new arrivals, Denver Health says its emergency department is feeling overwhelmed. Denver 7's Claire Lavazorio is finding out how this migrant surge is affecting our healthcare system.
The hospital estimates about 10% of patients walking through emergency room doors are migrants, while most are coming in with just seasonal illnesses like the flu. The migrant surge is presenting unique challenges for staff. With migrants arriving in Denver at an unrelenting pace, Denver Health's Dr. Steve Federico says many arrive sick and with unmet healthcare needs.
The first place that we normally find folks like that are in our emergency department.
From their journey on crowded buses to life in shelters,
they tend to share their illnesses very well.
The mere number needing care is creating a crisis that will require the attention of those at the federal level, says Federico.
Our emergency department has been incredibly overwhelmed by these patients.
Denver 7 met this family looking for help right outside of Denver Health.
Fuerte, muy duro.
It was tough, very difficult. From Venezuela, it took us 4 months crossing the border from Colombia into Panama. This mom tells us her family arrived in Denver about a week ago. When they got here, her 13-year-old son was sick, so she took him to Denver Health. I asked her about their experience.
Bien.
It was good. They took good care of him. They gave him all the medications there. And fortunately, we didn't have to pay for anything. Federico says what the hospital hasn't seen is an enhancement in funding to take care of this population.
As you might imagine, these folks don't have health insurance. They can't afford to pay for their health care. So we here at Denver Health, since we take care of everybody within Denver, we end up footing the bill for that care.
With more than 30,000 arriving in Denver so far, the city has spent more than $35 million on its response.
We're going to need to invest in the healthcare infrastructure as well, or it will reach a breaking point.
I'm Claire Lavazorio for Denver 7.
Sobering warning. And earlier this week, we showed you how the city's migrant crisis and the housing crisis are starting to collide. Several families are living under this bridge at 48th and Fox. We saw about 50 tents set up there. We talked to one mother living there with her children who are only 4 and 9 years old.
There's a lot of people, a lot.
Somos humanos.
We're human.
Eso. Que somos humanos.
That we're human and we need help.
And she told us that she and her children were kicked out of the nearby Radisson Hotel. Now, the city says that is not accurate, saying that hotel is being converted from housing for migrants to transitional housing for people experiencing homelessness. But a spokesperson says no family was discharged because of that move.